COVID-19 has been around long enough, but we now have some folks who are surviving, some survivors who are now recovering. But it's going to take months, if not years, for some to recover from the financial toll of beating this virus.
New tonight, only on Up Late, Reveal investigator Rebecca Lindstrom looks at the confusion surrounding the medical cost.
They are the moments that keep hope alive, the cheers and reunions with loved ones.
Those doctors and nurses, I mean, they deserve every penny they get.
Not only did Bridget Cook survive COVID-19, but so did her father and daughter, who spent 11 days on a ventilator. But Cook herself almost didn't go to the hospital.
In my head, I was going, we can't take another bill. We're going to lose our house. You know, how am I going to pay for this? And it's a lot.
So far, the bill for Cook's care is $18,000. She's waiting to see what her insurance will pay, but she fears it won't be much.
I read the other day, it pays like $300 a day for a hospital stay. And I'm like, holy cow.
She has no idea what her daughter's care will cost.
Hi, Daddy.
Richard Pellegrino, a man in Cobb County, was on a ventilator for about a week. His bill?
It was $199,000 and change. And that it was surprising because I've never seen that big a bill in my life for anything.
$18,000 of that costs associated with 2 visits to the emergency room where he was turned away without receiving the COVID test. Pellegrino also received an experimental treatment.
Yeah, I was offered and accepted the anti-malarial drugs,
which not all health insurance companies have agreed to cover.
You literally just described the typical surprise medical bills in the area.
Bernetta Hayes with consumer advocacy nonprofit Georgia Watch has a guide to help families navigate the patchwork of promises from insurance providers and the government. While most say they'll cover testing,
the treatment aspect of COVID-19 healthcare is where the confusion and some of the surprises will come into play.
The federal government has said it will foot the bill for the uninsured and Medicare, which Pellegrino has. Still, his last statement has him on the hook for $38,000.
We're living day to day.
Just search GoFundMe COVID medical bills, and you will find an almost endless list of families asking for help. Families like Cook, who made the tough decision not to get the inhaler prescribed as part of her COVID recovery.
Was like $360. That's a car payment. That's part of her house payment.
But Cook says she doesn't regret the decision to go to the hospital. Her husband put it simply,
I'd rather pay a hospital bill than a funeral bill for you. And that kind of resonated in my head.
From testing to hospital admissions, what are you being asked to pay? We want to hear from you. Email us at COVID-19medicalbills@11alive.com. Again, that's COVID-19medicalbills@11alive.com. And if you're wondering what to do next, we've put a link to this resource guide on our webpage.